Unlock your health potential. Learning to identify root cause. Number 9. Poor oral health. The health of your mouth mirrors the condition of your body as a whole. Once you stop and think about it, it makes perfect sense. After all, you are not teeth plus the rest of you. You are a single unified whole. We are taught from an early age that proper oral health is about maintaining healthy teeth. The simple acts of brushing and flossing are instilled in us so that we maintain our pearly whites. Yet oral health is much more than clean teeth. It involves the gums and their supporting tissues, the palate, the lining of the mouth and throat, the tongue, the lips, the salivary glands, the chewing muscles, the nerves, and the bones of the upper and lower jaws. Mouth lesions may be the first signs of HIV infection. Aphthous ulcers are occasionally a manifestation of celiac disease or Crohn's disease. Pale and bleeding gums can be a marker for blood disorders. Bone loss in the lower jaw can be an early indicator of skeletal osteoporosis, and changes in tooth appearance can indicate bulimia or anorexia. Recent research has detected periodontal bacteria in the affected joints of those with rheumatoid arthritis and near the hearts of those with cardiovascular disease. Bacterial and other toxins found in root canal teeth may similarly travel and wreak havoc throughout the body. Beyond helping prevent bad breath, tooth decay, and gum diseases, taking good care of your mouth, teeth, and gums can also ward off serious health problems. In fact, according to the Academy of General Dentistry, more than 90% of all systemic diseases, such as heart disease, diabetes, respiratory disease, osteoporosis, rheumatoid arthritis, and even dementia, have oral manifestations, including swollen gums, mouth ulcers, dry mouth, and excessive gum problems. Despite these statistics, the majority of Americans often take oral health for granted. In 2016, at the Academic Center for Dentistry Amsterdam, the largest dental school in the Netherlands, researchers reviewed the medical records of 60,174 patients aged 35 and older, looking for an association between periodontal gum disease and atherosclerotic cardiovascular diseases such as angina, heart attack, and stroke. They found that those with gum disease were twice as likely to have had a heart attack, stroke, or severe chest pain. In 2000, the U.S. Surgeon General called poor oral health in America a silent epidemic. He emphasized that oral health is not just about healthy teeth, but is integral to general health. He also pointed out that safe, effective measures exist for preventing the most common dental diseases, dental caries, and periodontal diseases. A 2016 report by Surgeon General Vivek Murthy and the Department of Health and Human Services makes it clear that the U.S. is still in the grip of a decades-long epidemic, albeit one that many Americans scarcely know exists. Several factors may impact your oral health, including not brushing teeth regularly, not flossing, and not using safe antibacterial mouthwash can lead to the accumulation of plaque, tartar, and bacteria, causing tooth decay, gum disease, and bad breath. A diet lacking essential nutrients, such as vitamin D and calcium, can contribute to poor oral health. Consuming high amounts of sugary and starchy foods, especially between meals, can contribute to tooth decay and gum disease. Smoking and chewing tobacco products can increase the risk of gum disease, tooth loss, and oral cancer. Hormonal fluctuations during pregnancy, menstruation, or menopause can increase the risk of gum disease and tooth sensitivity. Certain medications, such as antidepressants, antihistamines, and painkillers, can reduce saliva production, leading to dry mouth and increased risk of tooth decay. Habitual teeth grinding and clenching can lead to tooth wear, sensitivity, and jaw pain. And not receiving proper treatment for oral health issues. Manifestations of poor oral health include: the most obvious manifestations include ulcers, sores, or tender areas in the mouth that won't heal after a week or two, bleeding or swollen gums after brushing or flossing, chronic bad breath, sudden sensitivity to hot and cold temperatures or beverages, pain or toothache, loose teeth, receding gums, pain with chewing or biting, swelling of the face and cheek, clicking of the jaw, cracked or broken teeth, and frequent dry mouth. Less obvious manifestations include systemic conditions that may not be immediately linked to the mouth, such as diabetes, heart disease and stroke, cognitive decline, and increasing risk of dementia and Alzheimer's disease. Poor oral health is also linked to a higher risk of depression and worsened mood disorders. Additionally, poor oral hygiene can contribute to respiratory issues, as bacteria from the mouth can be inhaled into the lungs, potentially triggering infections or exacerbating chronic respiratory conditions.
Imagine discovering that the real power to heal has been inside you all along. Introducing Unlock Your Health Potential. This groundbreaking guide reveals how to move beyond chasing symptoms and instead uncover the true root causes behind your fatigue, mood changes, chronic aches, and other long-standing conditions, so you can finally experience the lasting relief and vitality you deserve. This book is a treasure trove of practical information. It offers the guidance and confidence you need to take charge of your well-being, break out of the vicious cycle of declining health, and rebuild the vibrant life you deserve.
To summarize, the health of your mouth mirrors the condition of your body as a whole. Beyond helping prevent bad breath, tooth decay, and gum diseases, taking good care of your mouth, teeth, and gums can also ward off serious health problems. In fact, according to the Academy of General Dentistry, more than 90% of all systemic diseases, such as heart disease, diabetes, respiratory disease, osteoporosis, rheumatoid arthritis, and even dementia, have oral manifestations, including swollen gums, mouth ulcers, dry mouth, and excessive gum problems. The U.S. Surgeon General called poor oral health in America a silent epidemic. Main factors contributing to poor oral health include bad oral hygiene, a diet lacking essential nutrients, consuming high amounts of sugary and starchy foods, smoking and chewing tobacco, hormonal fluctuations, certain medications, and habitual teeth grinding and clenching. If you suffer from mouth and gum disorders, difficulty chewing or speaking, teeth problems, sensitivity to hot or cold foods and drinks, cracks or sores at corners of mouth or on lips, chronic bad breath, coated, white, yellow, or furry tongue, oral sores or ulcers that take a long time to heal, teeth grinding or TMJ dysfunction, or you were diagnosed with a chronic disease such as diabetes, heart disease, or rheumatoid arthritis, your oral health might be due for a revamp. Remember, suppressing a symptom may ease your suffering and help in the immediate moment, but it never gets to the underlying cause. This approach does not take into account your body's natural self-healing mechanisms and causes long-term dysfunction. Thus, it is best to think why, how, and mechanism of various conditions, rather than focusing on the condition itself. Looking for tips and strategies on how to confirm and resolve this root cause? Our book, Unlock Your Health Potential, offers a comprehensive guide for how to confirm, address, and resolve the 24 major root causes discussed in this video series. For immediate actions you may take now to kickstart your healing journey, check our Master Your Health in 8 Weeks program. We hope you enjoyed and benefited from this short video. For a list of supporting references and resources, check this video description below. Please remember to like and share this video. May you achieve your health goals and experience joy, resilience, and optimal health.